Last year, we had an ice event in Austin and had to close the office for a couple of days. So instead of trying to get to the office, I was able to have the virtual assistants get immediately on the phone that day and reschedule the appointments, and also handle incoming calls of patients wanting to know what was going on with our office. It was made my life so much easier as a practice administrator. Responsiveness to any issue has just been tremendous. I have a sense they value me as a customer and they want me to be successful. The cost of hiring somebody in the United States with benefits is significantly higher than the cost that Waiting Room Solutions or the WRS Virtual Assistant Program charges.
I am thrilled to introduce Rick Lucas, the practice administrator of River ENT. River ENT has been a valued partner of WRS Health ENT Cloud since October 2021. Over the years, they have leveraged our virtual assistant services to streamline their operations from insurance verification to call management. Once again, thank you so much for joining us. Now, Rick, before partnering with WRS Health ENT Cloud, your practice faced challenges with time-consuming insurance verification and managing a high volume of incoming calls. Could you share more about a few challenges and how these challenges affected your operations and patient experience?
So River ENT opened its doors in March of 2018. At that time, it was one physician, and we could handle the calls and patient check-in with a receptionist at the front desk. As we continued to grow and we added another physician, staffing became an issue as far as how to handle the calls at the front desk, as well as patient check-in and check-out. It became a very stressful situation for our receptionist, to the extent I did not want to lose that individual because she was a valued employee. And so we looked for some alternative in which we could have someone assist her in handling patient calls. As it turned out, Waiting Room Solutions had an option for us with their virtual assistant program. We initially started with them using handling patient calls. We have a phone tree that allows patients or individuals who call to pick different options, and for the option to schedule an appointment, we set it up so that the virtual assistants could handle those phone calls. Immediately, I noticed at the front desk that it was quieter. The phone just wasn't ringing off the hook. Also, what I noticed was most of the phone calls were going to voicemail anyways at the front desk because my receptionist was taking care of the patient in front of them. And so now with the virtual assistant program, I don't have calls going directly to voicemail. They're answered by the virtual assistant with WRS, and then the patients are scheduled. And so there's just my receptionist at the front desk is there helping the patient and providing a better patient experience in the office. As we migrated, I had my individual who was doing surgery scheduling was also doing insurance verification. As we added our second physician, it became a point where she was spending too much time scheduling surgeries, which was a good thing, but was struggling being able to manage the insurance verification piece. They talked to us about their ability to do insurance verifications. And so we transitioned to Waiting Room Solutions insurance verification team, and that has just run so smooth. To this point, and I told our physician owner that there's no way that I could undo the virtual assistant program because I would have to add more staff, and I might lose staff that I currently have that I want to keep.
I am glad that you considered our VA services, but I'm curious, Rick, when you were considering the VA services in WRS Health ENT Cloud, did you have any reservations about trusting administrative tasks to a virtual assistant? If so, what were those concerns?
In today's world with COVID, folks are allowed to work from home, or at least some of the staff is allowed to do that. And as management, we're always concerned, are we getting the most out of that employee that's away, because we can't see them and really and watch and see their productivity. So one of the things that I really enjoy is we have a monthly meeting in which we go over the activity that's being handled. Allowed me much comfort to know that work is really being done. Now, I will tell you that I can know if patients are calling and saying, well, I'm leaving an appointment or a message to schedule an appointment, and it's not getting called back, or I'm not receiving the call back. I get those messages, but I don't get, phones getting dropped and all that. And so that's an issue. But we are able to cover those calls or those discussion points in our monthly meeting. The other concern that we had is we would be doing this offsite and out of the country. And so one of the things that I've had the opportunity to do is each person that works for us, I have a chance to have a brief phone call with them. So I'm comfortable that there's not a language barrier. And I will tell you that to this point, no one has been presented to me to work for us that has a language difficulty. They speak well, easily understood. That's a concern I had and one that's been overcome. The other thing that I always worry about, they're not on site. And so I always am concerned. I consider the virtual assistants as part of the River ENT team. So I wanted to have the ability to them to feel part of the team, and I wanted my River ENT staff to feel that the virtual assistants are part of the team. And so I've invited the virtual assistants to attend a portion of our staff meeting each month so that they can interact with one another. And that's been a really great experience, and it's really enhanced the experience of working together as a team.
Wow, that's good to hear. Well, thank you so much for sharing those, Rick. I would like to reiterate this. I know you've mentioned a few things earlier, but how did WRS Health ENT Cloud's virtual assistant services help address the challenges you mentioned earlier and eased any initial concerns or hesitations you had?
At least the folks that I get to work with at WRS, to be very responsive. If I've ever had a concern, I'm able to either send an email or a call. They quickly respond to the concern. I will say there was a time when we first got started. I have had a few patients complain that their messages were not being responded to. Example, I called Donna, our point of contact, and she produced a worksheet showing the date and time that they called the patient and a general snippet of either what the conversation was or they left a message. So in essence, and most of the time, they were leaving messages and patients weren't responding to those messages. And it was a patient issue, not a virtual assistant issue. And so the responsiveness to any issue has just been tremendous. I have a sense they value me as a customer and they want me to be successful.
That's really wonderful to hear, Rick. Now, by addressing these challenges, the communications, phone call management, your practice has been able to significantly improve operational efficiency and enhance the patient experience. Could you share more about the tangible benefits you've seen, such as how these changes have impacted your team, your practice, or overall patient satisfaction?
There is no way that I would undo this, and the relationship has been very positive between River ENT and WRS. Before I answer your question, I do want to go back. I have a note I wanted to cover, and it doesn't necessarily impact Austin, Texas, because our weather, we're away from the coast, so hurricanes don't bother us. We may get a snow or ice event once or twice a year, but in the event that there's an emergency where I need to close my office, phones can still be answered and patients can be taken care of. Last year, we had an ice event in Austin and had to close the office for a couple of days. So instead of trying to get to the office or assign someone to take a computer home and call from home, I was able to have the virtual assistants get immediately on the phone that day and reschedule the appointments. And also handle incoming calls of patients wanting to know what was going on with our office. It was made my life so much easier as a practice administrator. My staff, my front desk, is so much happier, and I can tell as I watch and listen to them interacting with patients, there's less stress in their life as a result of having the virtual assistants. The other thing is my staff also is so appreciative. As we've kind of worked through the insurance verification piece, we've reached a point where it's like we know what's going to happen. And I get a daily email on the status of where they are on insurance verifications. And in the event, if we have a work-in patient, we're able to communicate and they quickly turn around and get the insurance piece taken care of, the insurance verification taken care of. We actually prepare a document for the patient to sign, giving them the estimated cost of their visit that day, and we're able to stay on top of that. Patients love being able to know and not be blindsided at the end of the appointment what their costs are. And there's really no way for me to do that with my current staffing model. If I was to take what the virtual assistants are providing and bring it in-house, there are two issues that are at play that would impact me financially. The first issue is the cost of hiring somebody in the United States with benefits is significantly higher than the cost that Waiting Room Solutions or WRS Virtual Assistant program charges. And then the second issue is I would have to then find office space for them to take care of the responsibilities that they'd have, which would again increase my cost. In today's environment in medicine where inflation is rampant and reimbursement is slightly decreasing, we have to know where our costs are and we have to manage them. And so the virtual assistant program helps me manage my costs effectively.
Well, Rick, thank you so much for your feedback. Of course, your feedback is invaluable and we truly appreciate your partnership. Thank you for trusting WRS Health ENT Cloud to support River ENT.